Fantastic. So if you can turn to the person to the left of us, and if they're not, you can use that person, and introduce yourself. So hello, how are you? And to the other side, introduce yourself. Okay. There we go. Thank you. Now I feel like we all know each other a little bit better. Thank you. Take a seat. Thank you. Now, the way we like to run these seminars down under, this is where I'm from, Australia, is we like to take different approaches. The approach I'll take today, my heritage is Greek, I want to take a Socratic approach. Now, Socrates liked to teach by asking questions to the audience a lot. So, if you allow me, I'd like to ask a few questions to you through the course of the lecture. Only because it makes us think about things and think about what I'm talking about. Because I can sit here and talk and give you the whole story, but maybe what you think I'm saying doesn't make sense, or it does. So I'll be asking questions to you, and I'll let you ponder about it and think what you may think. Okay, here we go. Why is it that two people can religiously follow the same diet, do the same exercise, have the same mental stress as each other, while one gets a result and one doesn't? One fails and one doesn't. Why is it that some people follow certain diets, the South Beach diet, the GI diet, or the Atkins diet, or the grapefruit diet, and why do some people get results with one diet and some people don't? How about exercise? Some people respond to yoga, or Pilates, or both, or none at all. Some prefer to go to aerobics, sweat it out 3-4 times a week, and respond, and some don't. Some prefer weight training routine exercise. Some don't. And yet everyone has an individual approach, because all these differences only exist because of our own variances in ourselves. Is it better to meditate, undergo hypnotherapy, or psychoanalysis? Which one's the better of the other? Or is it a combination? Really, it boils down to our 5 senses. And it's our own 5 senses of our own individual experiences that determines it. It's our brain's conditioning, perceived and or actual senses now, in the past, current or in the future, that will determine the result if we succeed or not. So here we go. Let's start with a Socratic approach. I want you all to close your eyes, please. And I want you to point in a direction that you perceive north is. North. Point with your eyes closed. Close your eyes. There you go. Sorry. Point towards north. Okay. Come on, everyone point, please. Everyone put a finger up in the air. Dr. Fred, thank you. Okay. Now don't move your hands. Don't move your hands. Everyone open your eyes. Now look at everybody's direction. Everyone has a different direction. Now, there's an actual true north, whichever way it is. That's the reality of north. But everyone's perception of north is different. So who's right and who's wrong in the perception? Because that's your perception. The reality is north is true north, wherever it may be. I didn't check it. Normally I check which direction it is before I walk into the theatre, but I came in from the back and I came this way and I got lost. But it's the perception of how people see it is what really matters. That's what determines your mental state, your perception of what's going on inside of you and inside around you. That's what you've got to understand on that one. It's like this violinist. Now, he's taking in data from his motor fingers, from his ears, hearing the violin and the tone, his vision, seeing his fingers going up and down and so forth, and the vibration of the instrument through his hands. So all these are concurrently happening at the same time in order for him to get feedback. That's how we are. We're constantly getting feedback in society. See, we're here in this room. You're listening to me on the microphone. In the background, there's music. Who can hear the music? Yeah, not everybody, but most people can. And I think it's nice. Let it play. But who can hear the air conditioning? Yeah, that's actually more prevalent. So these are background noises that we're taking in constantly. We don't even know. I, looking at you, am looking at the traffic behind me. So I'm not only concentrating with you, but the traffic's going like this. So there's data going into your body all the time, and we shut it down or we let it affect us, depending on what happens. Same with the violinist. It's okay, leave it. Yeah, I like it. It's good. It relaxes me. Okay, so now what we're talking about is basically personalized medicine. It's basically the advent of personalized medicine, be it your own identity, what you are and what your illness or issue might be in health, and how you perceive it. That's where medicine now is tending to... all research that I've seen in the last 10 to 15 years is going towards personalized medicine now. Why? Because we're realizing that everyone has their own perception of reality and their own perception of how they perceive their illness or their health or their own state of mind. So this is why I think the demand has driven the medical profession to approach medicine in this way. So there's 3 or 4 areas I want to talk about quickly, and I won't go through this because it's quite laborious, but there's 3 aspects: mental health, physical health, and chemical health. Mental health, we are governed primarily from our gene pool, first and foremost. What's happening from where we're coming from. First and foremost, it is because the genes are incorporated into your biology from day dot. From conception, your mother is influencing your every thought and well thought, ill thought, from the day you're conceived to the day you're born. Literally, why? Because your body is laced with all the neurochemicals, the endorphins and enkephalins that your mother's feeling every day during the pregnancy, and that goes straight through her into the placenta, through the umbilical cord into you. So you're constantly getting this data from an outside stimulus, be it your mother at the time. So mental health is very much governed by your gene pool and your initial environment from where you actually come from. Physical needs, all animals have needs to breathe, water, nutrition, food, sleep, safety, and we all strive to look at having these physical needs met. The physical needs are intimately bound with our emotional needs, always. The main focus of human gene pools and human psychology is based on having both met at the same time. Your emotional needs, emotions create distinctive psychobiological states in us and drive us to take action. What does that mean? It means any emotional stimulus makes us react. We seek to feel fulfillment through the interaction that we do with the environment around us, that being people or situations at work or home or wherever we may be. Consequently, when these needs are not met in the world that nurtures us, we suffer. We start experiencing stress, anxiety, depression. And that will impact us and the people around us always. So basically, the brain is responsible for sustaining our consciousness, and every person's consciousness relates to the multiple realms of life, be it physical, chemical, emotional, and spiritual, in its own unique way. Since each brain is it's like its own fingerprint. Its function distinctly is according to its own design. Everyone's design is their own. There is no one-size-fits-all approach to mental health, but with reconditioning and retraining of your brain, whatever avenue you choose to explore, be it diet, exercise, mind-body therapies, qigong, exercises, Pilates, yoga, Tai Chi, you and your body will become congruent and you will attain your best results. So the real key here is brain conditioning. The brain conditioning can be a key that may unlock any mental system to make it more effective. The most important thing is to harness the ability to control and re-educate your brain from experiences that you've had in the past that might have hindered your performance to experiences in the future or present to allow the performance to occur. So we talk about conditioning. The first person that comes to mind is this gentleman. I see a few smiles. Ivan Pavlov. He's a giant in his own right. Pavlov, 1927, process by which neutral stimulus acquires the power to elicit a response by being repeatedly paired with an unconditioned stimulus. So basically we all have, without realizing, a conditioned response to many things. And Pavlov was the first to note this with the, who remembers the bell ringing and the saliva and the dogs? We all know that one? Yeah. So I'll go through this quickly. Now, Pavlov's dogs has been affected by the economy at the moment. Here, he's drooling. But here we go. So classic conditioning is basically when an unconditioned stimulus, like a meat, is automatically elicits an unconditioned response when the dog salivas. A neutral stimulus, a bell, is repeatedly paired with the meat. So when a bell is paired with a meat, the dog starts to get conditioned to whenever he hears the bell, he starts to saliva. So there's a paired conditioning. Now, unrelated to everything we might know or not, we get conditioned every day. Knowing it or not knowing it is another story, but the conditioning is what really is the key to resolving most of the people's issues when they get entrenched in a pattern or entrenched in a psychological state that they can't get out of. So this is what I spoke about, the bell, and here we go again. So basically there's food, the dog salivas, they introduce the bell, nothing happens. They introduce the bell and the food, the dog salivas. Then they introduce the bell, the dog salivas. So basically now the bell, without the food, can make the dog respond. And that's where the subconscious and the conscious parts of the brain start to interact with expectation, anticipation, belief. So the dog's starting to believe that when he hears the bell, he's going to start eating soon because he's expecting the meat. A few links there for you. I'll skip that for a second. So let's just jump to this. Let's all close our eyes for a moment. Some have already had them closed, but that's okay. So I want to go through a little experience, and the background noise, music, I shouldn't call it noise, is helping us out here. I want you to think of a hot, steaming day. It's hot, blistering hot. You've got beads of sweat racing down the side of your cheek. You're sweating, you're hot, you're tired, you're fatigued, your legs are starting to hurt. You just want some water. Your mouth's dry, like sandpaper. You just want a glass of water. You just need something. You walk into a room and all you see is a few lemons on the desk. And you say, oh, and you see a knife, you cut a lemon, and you're so thirsty, you just can't help yourself. You just start biting into the lemon. Oh, he's getting the lemon juice in your mouth. Lemon. Oh, thank God, I've got some lemon juice going in your mouth. Okay. Now, hands up. Who's salivating at the moment? Who's got some saliva in their mouth? Okay. All right. What you just did there was a coupled response. Just by words, that I'm saying through this microphone, your body's responding and releasing chemicals in your mouth. So think about it. If you can have an endocrine release response from your amylase cells in your mouth releasing saliva because of just words I'm saying over this microphone, because your body is coupled with heat and what lemon does when you have it, and your body's responding just by words. So then how then, think carefully, and this is a very serious Socratic moment, how can then, if you're saying certain words to somebody, not affect them in a chemical way without us even realizing it? We do not know how profound and what the extent of effect that we have on people depending on what we say and how we say it. Just remember that, because just like we can elicit immunological release, digestive response just by words, we can do it in many other ways, in a positive way and a negative way. Just something we want to come back to later. Okay. So to understand a bit more about the talk we're going to get to, which we've started, I want you to understand the anatomy of the brain. And the giant that I followed his work until he passed away in 2007. So we look at the anatomy of the brain. The quality of the brain, genes give direction of development. Genes do not determine destiny. Environmental factors determine if the genes get turned on or turned off. So you can have genes that might predispose you to a cancer, but you'll never have that cancer expressed because the genes don't get switched on. If you have the genes switched on, you'll have the cancer expressed. So stimuli affect the environment, and environment affect us, and that will determine our gene pool if they get switched on or get switched off. The brain develops from in utero to old age, even up to 90. Most neurons get pruned away, and neuroplasticity occurs daily. Neuroplasticity is a buzzword now, and everyone uses that word a lot because now with the medical imaging, we can see changes occur instantaneously in brain function. But we have 12 growth spurts between the birth and your early 20s. Now, in the 1950s, neurologist Paul MacLean proposed that we did not have one brain, but we actually had three. Sorry, let's go back. He passed away in 2007. He was a neuroscientist, professor in psychiatry, physiology, and the brain itself. He was from Yale Medical University. MacLean's evolutionary triune brain, meaning three brains, proposed that the human brain was in reality three brains in one: the reptilian brain, the limbic brain, and the neocortex. Now, this is very important because this is fundamentally what we're going to be talking about today. MacLean found that the three brains are connected, but each of them operate differently and individually on their own. The reptilian brain, the limbic, and the neocortex. They're the fancy names for those three brains. I still can't pronounce them, so I'm not going to say it. Paleomammalian. Okay. So the three brains. The reptilian brain is about self-preservation, aggression, fight, flight response. The limbic brain is the emotional brain, how we feel. And the neocortex is all about our intellectual tasks, about thinking. So, reptilian brain drives to establish and defend territory. Its primary functions are for feeding, feeling, instinct, and fornication for the limbic brain. And the neocortex is the conscious brain, or the modern computer. It's very distinct to us as human beings. So the reptilian brain, to repeat, is a brain that is responsible for muscles, balance, and automatic function. It consists of brainstem, medulla, and pons and cerebellum. It's again the fight-flight response. The limbic brain is a term that MacLean first coined back in 1952. Known as a mammalian visceral brain, it concerns with emotions and instinct, feeding, and sexual behavior. It's based in the hippocampus and amygdala, hypothalamus as well. Now this slide's very important. This is what a lot of our responses to many things in our life are about. The limbic brain, it has vast interconnections with the neocortex, which means that brain function itself is neither purely limbic or neither purely cortical. It's a mixture of both. But MacLean highlighted a great danger in that the limbic system had the power, because the limbic system, not the more advanced part, like the neocortex, was the seat of our value judgment and is therefore the lesser evolved that makes the decision of what is right and what is not. For example, a bit of neurology. The limbic system responds in 12 milliseconds, the emotional part of ourselves, whereas the neocortex takes 25 milliseconds. So for example, if you are on a diet and you say, I'm not going to have chocolate, you get stressed and you're having a bit of a reaction and you grab the chocolate, you start putting it in your mouth. Before you realize it, the limbic brain in 12 milliseconds has put the chocolate in your mouth. In 25 milliseconds, your neocortex is saying, oh my God, I've got chocolate in my mouth, I should be dieting. It's too late because the limbic has already jumped in ahead of the neocortex. That's what happens. It's like, I want to see my wife, I want to say I love her, I'm not going to argue with her today. You walk in the house, she looks at you, you look at her, and you start arguing. And then you realize, hold on, 12 milliseconds later, I shouldn't be arguing because the neocortex was too late in cutting in from the limbic system. It happens to us always. The key is to be able to integrate these systems, these parts of your brain. And they're the locations on a cross-section of a brain for you, for the ones that are like anatomy. Now this is what I'm talking about. Let's have a look at this with a pointer. You have sensory input at 1 and 2, right at the beginning. This is the black box. This is how we respond. It comes into your brain through your senses, those 5 senses I spoke about before. The emotional thinking region is the seat of judgment. It's the limbic brain, right here. And the memory response happens in 12 milliseconds. You're responding and it's jumped into the emotional judgment already. It's gone out the gate before the neocortex, the rational thinking. Don't argue with your wife. Don't put the chocolate in your mouth. Comes into play, takes 25 milliseconds. You've already done the judgment and the response before your brain can control it. That's the problem that occurs with us over and over again. The key for us is to integrate this part of the brain and that part of the brain to work together so one doesn't supersede the other. So the limbic brain, emotional brain, always alerts and provides information. It works 80 to 100 times faster than the neocortex, able to send messages throughout the whole body through neuropeptides and enkephalins. And the neocortex is responsible for higher functions in man especially, also known as the neopallium. The neocortex is a superior layer of the brain. It's also the main area of the brain, taking up 2/3 of the brain in total. So brain conditioning is a way of accessing and recalibrating our emotional connections and associations with stressful stimuli so that we can achieve and maintain a desired result with a fraction of effort, not just willpower alone. Many people eat when they are stressed or emotional. If the stress becomes coupled with the weight gain, the physiological state that promotes the deposition of fat, a response known to us occurs with excess stress hormone in circulation. This is metabolic stress syndrome, or metabolic syndrome X. When people get stressed, they eat, they put on weight. Then the association, remember Pavlov, the conditioning of stress hormone and eating puts on weight. So then what happens, but it also is possible that in the presence of only the stress now, with the absence of food, that can also release the stress hormone, causes the deposition of fat. So now you've got it happening without the food. I have, there's some therapists in here, I have patients come to me, especially women, that go to the gym 20 times a month, like 5 days a week. And they can't lose weight. And they say, you know what, I go to the gym 5 days a week, I don't eat, I'm doing all the right things, and I still can't lose weight. And I've got to say, they're doing everything perfectly. They're doing everything like they should do, and they can't lose weight. And why? Because they're coming in and they're talking to me like this, and they're stressed, and they're carrying on. And the reality is, it's their cortisol, stress hormone, that's coupled with the weight gain that they had initially. And even though they're doing all the right things now, unless they reset and recalibrate and recondition their brain, it's not going to work, because stress and stress hormones with the absence of food still keeps the fat there. And that's basically what that isolates. Thus, when was originally comfort food can become a response to create the effect of weight gain in the absence of actually even eating the food. So that, again, response is a psycho-neuro-immunological response. Do you remember the lemon? How we had a response of chemicals in our mouth? That is all come from Robert Adler. In the 1970s, Robert Adler in New York, he started the Adler Institute in New York City, New York. He studied the connection between the brain and the immune system, and basically how stress, anxiety can influence our immune system in many, many ways. So let's go quickly through these slides. Stress or perceived stress affects the limbic system. You've got cortisol, stress hormones being released here. It can increase your fluid retention, so you can't lose weight. You increase your antibodies, so you're getting eczema, you're getting rashes, you're having allergy reactions, urticaria and a lot. You're getting gluten resistance because of the same response through cortisol. Over here, you've got the adrenal function. You've got sympathetic and parasympathetic, epinephrine, acetylcholine. You're increasing the heart rate, increasing blood pressure, airways being constricted, you're getting asthma, shortness of breath. I mean, this is all coming just from perceived stress. When you even think you might get stressed, even think you might walk into a room here in Hong Kong, you're going to meet all these people and you're going to lecture to them and you're going to hope they're going to understand you. My perceived stress was making me... And then I relaxed when I got you all to stand up and meet each other. And it relaxed my airways. That was that pathway for me. So everyone has a response. Let's go to the next slide. This is when we do have stress. Here we are. We're releasing adrenaline. And basically, too much adrenaline from the Hpa axis. Now, have we heard of the Hpa axis before? Pituitary adrenal axis? Yes? Okay, that's the main axis that is in your brain that controls the release of all these hormones. And that's what stimulates the release of adrenaline, noradrenaline, cortisol, and all the hormones in your body that respond to stress. Basically, you're increasing visceral adipose tissue. In other words, you're increasing your fat, you're increasing your blood pressure, you're affecting insulin resistance. Again, going through here, leading to arteriosclerosis, hypertension, feeding all the way back to here, which feeds into depression, anxiety, which then gives you more adrenaline, and the loop goes on. And this is where people with chronic diseases get stuck in that loop. Over here, you've got it reducing your IGF-1, which is basically your anti-aging gene. People get older when they're stressed. They age very quickly when they're stressed. It's just another pathway to show you how stress can affect you in many ways. Come on, okay, so we're going to skip this because this is just more science on the Hpa axis and the feedback loop to how stress releases chemicals in your body and how it affects your emotional state. And basically, stress can cause many things, from insomnia to anxiety to depression, ADD, ADHD, chronic fatigue syndrome, fibromyalgia, irritable bowel syndrome, can drive people to alcoholism. Antidepressants are also there to help regulate the Hpa axis, albeit with a limited benefit for some. Some do respond quite well with it. So emotions can be cognitive or non-cognitive. They are thoughts, feelings, and ideas. Emotions are in every cell in our body. They are everywhere. Health is intimately tied to our emotional state. Now, pain is an emotion itself. When someone feels pain, it's actually an emotion. Pain is a subjective emotion because it's your pain. It's how you feel the pain yourself. Everyone learns the meaning of pain through experiences usually early in life. As an unpleasant sensation becomes an emotional experience. So basically, here we are. We've gone through the theory, the conditioning, we've gone through the anatomy of the brain. There's 3 brains we have to integrate: the primitive, the limbic, and the neocortex. And we know basically emotions and our immune system can get affected by all this as well. So we need something that actually can integrate all these 3 brains. Now, for the last 20 years, I've been using a technique called Neuro-Emotional Technique. Now, the reason I've used this technique is that very reason I just stated. It's the only technique that I've had because I've used EMDR, NOT, I've used hypnotherapy, I've used psychology, I've used, and psychiatry is brilliant as well, don't get me wrong, but one technique that I've seen that integrates all 3 parts of the brain and makes all 3 brains talk to each other and make them all work together as a unit that I've realized is this technique, and I'll explain to you why. NET, Neuro-Emotional Technique, is a 15-step multimodal intervention incorporating many principles. TCM, Chinese medicine, behavioral psychology, and a feedback technique called muscle testing. NET is a biopsychosocial protocol that attempts to address all aspects of pain, emotions, musculoskeletal, digestive, visceral problems, weight problems, and the like. The Neuro-Emotional Technique is a method used to normalize unresolved, basically conditioned responses that haven't deconditioned or reset themselves. It's a technique that allows you to help recalibrate and recondition the brain. NET practitioners are trained to assist in the healing process by identifying the balance and balancing unresolved emotional issues. It's a mind-body approach. There's fundamentally 7 dynamics of NET. There's 7 pillars it's based on: muscle testing, emotions, Pavlovian responses, meridian system, repetition compulsion, the role of memory, and somatic responses. So I'm going to give you one slide on each one. Muscle testing, it demonstrates that muscles can be accessing the physiology of the body, including the physiology of emotions. Muscles that initiate a test usually test strong, will test weak when inhibited with a negative response or incongruent statement. Let me give you an example. Professor, step up. Thank you. Face the audience. Okay, so what's your name?
Cecilia.
Okay. Just say, my name is Cecilia.
My name is Cecilia.
Okay. Push up in the air. Push up straight. Okay, so there's resistance here. Say it again.
My name is Cecilia.
Good. Okay. So now say, my name is Mary.
My name is Mary.
Okay. Say, my name is Heather.
My name is Heather.
And say, my name is Cecilia.
My name is Cecilia.
I'm wearing red glasses.
I'm wearing red glasses.
I'm wearing black glasses. No, she's got to be black there. I'm wearing white glasses.
I'm wearing white glasses.
I'm wearing red glasses.
I'm wearing red glasses.
Now I'm doing it again just so you know it's not a fatigue issue. Thank you, Professor. Okay, so basically when something is congruent, the body says, yes, I agree with that. When something isn't congruent, the body says, no, I don't agree with that statement. It's an auditory stimulus. Remember we spoke about auditory stimulus? Remember the lemon? Remember the violinist? The body responds to sound. This is a somatic response. So when you stimulate the body by an auditory stimulus, if it agrees with it, it will respond strongly. If it is incongruent, it doesn't agree with it, the body gets distressed. It says, no, that's not correct. It's like a lie detector, but it's a very neat way. Now, modern day, there's a lot of psychiatrists, psychologists that use galvanic skin responses. Like the lie detector does that as well. So you heart monitor, you look at skin, you look at pupil dilation. The way we do it is just a simple muscle test to the Golgi tendon organ, which is another spinal reflex response. So that's that one. Okay. Emotions are physiologically based. This is Candace Pert, and Candace Pert won a Nobel Prize for this. Emotions are based on minute molecules and proteins that circulate in the body. No one realizes that emotions are actually liquid. When you have an emotion, it's a specific molecule. Like if you have fear, and you have fear racing in your system, fear tends to radiate through the kidney, and it releases chemicals, and that substance, information substance, then will circulate through the body and elicit in the brain a sense of fear, especially in the amygdala. And these chemicals then race through your body and give this global sense of fear throughout your body. Candace Pert, in 2003, made this discovery, started publishing on it, that basically emotions are based on neuropeptides, hormones that circulate throughout your body. We spoke about this gentleman before, Pavlov, and his conditioning. As I said to you before, our conditioning is what sets our process. Meridians, we might know about this as well. Acupuncture theory, no, it's about 4,000 or 5,000 years old, linked to emotions throughout the whole body. Anger be related to the liver meridian, when someone gets angry, or fear related to the kidney meridian. When someone gets really scared, sometimes they pee themselves. Why? Because they're so scared. The kidney bladder has got to do with fear and dread. That's how that's intimately related. Now, Freud's contribution to this is Freud proposed repetition compulsion. Once we have been emotionally traumatized, we will non-consciously seek to repeat the like trauma in future. It's a concept that has been revised recently. It's like, you know, your father's a gambler, and you see how that's affected the family. You say, I'm never going to do that. I'm never going to marry a gambler. And guess what? Your husband is a gambler. Or something similar to that. You attract what your body knows is familiar. And that's what unfortunately, your body knows to be normal. What we're saying is to recalibrate your brain, you need to reset your norm to be what you want it to be, not what your body's biology knows it should be. The role of memory. Elephants, yes. When the brain stores a memory of a traumatic event, it encodes it and replicates it in your physiology over and over again. And I'll come to a few examples on that very soon. Somatic responses. This is what we spoke about with the lemon and one. This is when you hear words and it evokes a response. Basically, a picture of a horse or a wild horse, each evokes a similar response. Oh, sorry, not a wild horse. The word horse or a picture of a horse can, in a body, evoke a similar response. Just like the words of a lemon, if I put lemons up on screen, it will initiate the same response. That's Korzybski's work in 1994. So in summary, NET is unlike previous approaches in cognitive behavioral therapies. It combines 15 steps to access and manage imbalanced emotions that have not resolved. The process uses 7 principles to integrate and clear the aberrant emotions and their associated psychoneuroimmunological expression. It seeks to discharge any negative effect. It is a multimodal therapy that uses cognitive behavioral principles under a biopsychosocial framework to treat a range of different conditions. So NET integrates the triune brain. It actually brings it together. And how does it do it? The reptilian brain is accessed via the reflex of the muscle test. The muscle test uses the reptilian brain. So that's part of the technique. The limbic brain is when we talk about the technique and we elicit the emotions. That's accessing the limbic brain. And the neocortex is when we then talk about what comes up in the session and we integrate it with the patient at the same time. So we're basically using integrating the 3 steps all in one session and all in one time. And you'll see this when I do an example soon. So here we go. If we look at this up here, your reptilian, limbic, and neocortex, the basic instinct, impulse, or reflex, that's a muscle reflex technique you use for NET. When you go through emotions with NET, and then at the end when you tie it up and you make the patient understand why that issue came up. That's the neocortex. And you're integrating these three brains with the process of using NET. There's been a lot of research published on NET using muscle testing. NET is published on infertility, polycystic ovary, published 15 papers on infertility, polycystic ovary syndrome, hypothyroidism, anxiety, depression, low back pain, chronic neck pain, phobia, arachnophobia. There's been one. There's ADD, I said, cancer patients, pre and post effects, and their response to anxiety and depression. So there's probably over 50 papers, close to 50 papers now being published on this therapy. So it's an up-and-coming therapy, even though it's been around for 20 years. Its results and the research that's coming out is very, very groundbreaking. So here we are. Everyone's got this sheet of paper in front of them. This is called the Dram. Now this is a simple, easy assessment for anxiety and depression. Now I've published a paper on 188 patients using this assessment tool. It's a psychometric assessment tool. What I'd like you to do, not now, at home, is basically go through it and mark it up front and back. The modified somatic perception questionnaire is for anxiety. It's called the distress and risk assessment method. So let's just keep on going here. The modified somatic perception questionnaire on one page is the anxiety assessment, and the modified Zoom depression index says it itself, it's for depression. So it's funny, but just if you can answer this honestly and truthfully and bring it back to the department and hand it in to Professor Cecilia, and she'll have it scored, and she'll score it for you, and then she'll get back to you and let you know where you're at. Because it's amazing to realize I treated 188 patients consecutively, and these patients didn't come in to me for anxiety or depression. They came in for neck pain, back pain, allergies, headaches, sciatica. And when they came in, this is a scoring that Professor Cecilia will do, and I'll move that one quickly because I want her to do it for you. But the results we got in this study was we got a p-value of less than 0.001. Now, anyone that knows their stats, anything less than 0.05 is statistically significant. Anything less than 0.01 is clinically and statistically significant. We got a p-value of 0.001 using this therapy, showing the differences with anxiety and depression. So it seemed to be a viable tool to use for future reference. In other words, we've got a good result. So here we are. These are the results of 188 patients that came into me, not for depression or anxiety. They came in for other things, back pain. But I chose, as a doctor, to find out, you're coming to see me, fine. But let's see what's really underneath it. Let's just do this. And I gave this patient, this sheet to all new patients that saw me for 3 months. And there was 188 new patients. Of the 188, only 44 were normal. 44 of 188. So 144 had problems that me as a therapist and a doctor of acupuncture and chiropractic classically would not see or even realize that are there. So how am I going to give that patient 100% care if I'm ignoring or not even looking for this? I have a duty of care as a doctor to know this. I have a duty of care to know that I need to look at everything for the patient to get them well. at the beginning, 63 were at risk of having anxiety or depression. 10 were depressed. 10 were semantically depressed, and 5 were psychometric. In other words, these 5 were on medication. And it's interesting to see these 5 that were on medication were the same 5 at the end, because medication didn't change. So that was consistent. That makes sense to me, because they're medicated. So I'm not going to have an impact on them because they're under the influence of drugs anyway. Do you follow? So that stayed the same, so that made sense. But the light blue is pre. This is when they first came in. The red is post-allocation. In other words, after the treatment. After 1 month of NET, that's basically 2 sessions a week for 4 weeks. So that's 8 sessions. After 8 sessions, 120 went to normal, and only 21 were at risk still, and only 2 depressive, and 3 semantically depressed. So that was a great response. So basically, the sheet you've got in front of you, once you fill it out and you bring it back, the department here will be able to tell you where you're really at. And it's good to know, are you suffering anything or not? And then they can give you advice. They might give you Qigong to do, they might give you meditation, they might give you whatever they are doing at the time, they will direct you. But it's good to know where you're at. So let's go through some cases. Now this is where the fun starts. A 48-year-old managing director is in charge. He's trying to lose weight for 6 years. Could not lose weight. Why? His condition response when we did the therapy, at 5 years old, his dad was the authority and his father was overweight. I'm okay, and what we tested with him was, I'm okay being the boss and slim at the same time, and his body would go weak. Because his body's belief was, if you had to be the authority, you also had to be overweight. Because his father was the authority, his father was overweight. So once we cleared that conditioning, that response in his body, he lost 4 kilos in 6 weeks and another 3 kilos in the following 8 weeks without doing anything different. This is just recalibrating his conditioning. A 24-year-old male wanted to put on weight. Very skinny, very bony. Trying for 2 years. His nickname was Bones, because he was given this name by his family and friends. It was a term of endearment. This is how everyone liked him and knew him. Hey Bones, how you going? Hey Bones, what are you doing today? So we had to do with, I'm okay not being called Bones and still being liked. We cleared that and he started putting on weight. It's funny. It works both ways. That's why I'm showing you the 2 sides of the coin. A 32-year-old mother of 2 could not lose weight for 4 years. The NT for her was when she was 4.5 years old, she would be force-fed to keep quiet. She would even be smacked. Now she had an oral fixation. Now what would happen is she would be given a bottle to keep quiet. So then her body started to associate an oral fixation in order to keep calm. And that's how, once we cleared that, she didn't have to put things in her mouth to stay calm. She started to lose weight. This is important. This is an interesting one. I had a male, the elite athlete. This is, he's actually, he's in the media, this guy. When he was 22 years old, he was going to the gym 4 or 5 times a week. Now he's 27, he had 7 kilos overweight, he wasn't going to the gym, he was smoking, no job, no girlfriend, and severe dairy allergy with the associated eczema. He had eczema all over his face. Had eczema around his eyes, his face, and actually behind the knees. At 22, we went back through the therapy, and at 22 years old, we found out, well, he got a phone call as he was leaving the gym that his father had died of a heart attack. He was eating a cheese sandwich at the same time. So let's think about it. He's got cheese in his mouth, right, dairy and gluten in his mouth. He's just leaving the gym, so he's exercised, he's slim, and he's eating a cheese sandwich. He gets the phone call at the shock that his father just died. So his body then associates dairy, gluten, gym, exercise, being slim, with someone close to him dying. So he then, without realizing, starts not going to the gym, putting on weight, and having a dairy reaction. As soon as we cleared this, he lost 5 kilos in 5 weeks. He's not smoking. He's got a job in 4 weeks, a girlfriend in 3 months, and no dairy, and the eczema from his eyes, and behind his knees, his neck, everything resolved in 3 weeks. Again, a psychoneuroimmunological response. And again, unless we do it and look for it and search for it, you won't know. And this guy was spending thousands, skin specialist, dermatologist. He was doing sun therapy. He actually bought a laser for his skin. Again, all these things can work for some people, and some people he might not. You just got to source the etiology of where the issues are coming from. We'll skip this one. That one, Rebecca. Let's see this. Yeah, Rebecca S. 30 years old. All says looks good and looks better, but feels exhausted inside and depleted. Okay, so Rebecca is a corporate executive. She looks great. She looks well-to-do, dressed, always upbeat, ready to go. But from the age of 14, she would act like everything was okay and fine, so all would assume she was content and everything, yet internally turmoil because she didn't think she fitted in. Did not speak up because of fear of saying something inappropriate and humiliating herself. So she would always act like everything's fine, everything's great, but really she felt ostracized and isolated from the age of 14. She's still doing it at work, and now it's reached a threshold where she can't cope or function anymore. So she starts to respond in a negative way. She's fatigued and tired. Ali, 25 years old. Was never stuck and restricted. I'm just trying to remember these patients so I can give you the background story. Was never stuck and restricted or disciplined in any way. When he found Ellie, I remember him now. Okay. When he found himself in a predicament he can't get out of, he'd smoke. Now, this gentleman goes back to when he was 18. He was forced to go into the army. Due to mandatory service at the time, he started smoking. So smoking is associated with a conditioned response of finding himself in a predicament where he's disciplined and stuck. So whenever he feels stuck, he starts to smoke. Why? Because when he was in the army, he had to go to the army, he picked up smoking. So now whenever he feels stuck or restricted, he then starts smoking, even though he tries to stop. We spoke about bones. Casey, 12-year-old girl, been on Keflex for 1 year, from 1 year of age. This 12-year-old was suffering a lot from a lot of antibiotics. They tried many traditional medical and allopathic approaches to rectify the reflux and constipation to no avail. The condition response started from at birth. She was 2 months premature, and mum was trying to hold her in by not defecating or urinating because that would put pressure on the baby, giving the sensation of giving birth. So think carefully. If the mother's trying to hold back and not go to the bathroom because she's worried about prematurely giving birth, the baby then gets conditioned from in utero thinking, well, urinating or maybe even going to the bathroom could be life-threatening, so I won't. She creates urinary reflux, so the body's saying keep the urine in, and constipation because of this conditioning. The condition response was to hold wee and poo as this could have been life-threatening. Once we resolved this girl within 2 weeks went off all antibiotics. I spoke to her urologist, and he actually wrote up this paper with me. We spoke about that one. Bo, a 28-year-old male, difficulty in performing with females, impotency, anxiety, depression, avoidant behavior. He would stop going out with girls because he was worried about once he got to the stage of sexually performing, he wouldn't be able to perform. Went back to when he was 13 years old, caught by mum, his mother, masturbating and laughing at him. As such, he expects to be laughed at by women in a sexual arena. or even if when he exerts himself in any way. As such, also stop going to the gym, because any physical exertion that elicits any excitement or heart rate, be it masturbating or be it exercise at gym, he was worried that people might see him and look at him and laugh at him. It goes back to when his mother did that inadvertently. We cleared that, and that resolved his issues. Actually, within a week, he told me. He rang us at the clinic. Okay, we spoke about that one. Sugar intolerance. Brody, a 6-year-old. Every time Brody ingested any sugar, he became violent and aggressive, hitting anyone in sight, very irrational and non-responsive, in a tantrum. This young boy was affected by 3 months in the womb, in utero. The mother contemplating terminating him because of stress with partner and constantly eating jelly beans while considering aborting the fetus. She was constantly eating jelly beans because she was stressed. Should I? Should I not? Should I? Should I not? So the ingested sugar elicits a potentially life-threatening situation for Brody. Every time Brody has sugar, he says, am I going to live? Am I not? That's what his body was saying, literally. And that's why he became aggressive and irrational, not knowing what to do. We resolved that, and Brody now is, he's actually 9, and he's doing really well at school. Actually came second in class for maths, which is very good. Okay, let's see what else. Okay, let's... Isaac, 39-year-old male. As friends, he gets on with females, companions, can easily be with them, but when they become partners or lovers, this applies to females too, things became dysfunctional and the relationship will always fall apart. So basically, he could have a friend, but as soon as he wants to take it a bit more seriously, everything will start falling apart, the relationship will not work, somehow something will go wrong. Went back to when he was 12, his parents, who were partners and lovers, divorced, and anything he did failed. He tried to keep him together, it failed. So his physiology knows what is normal for him is that the friendships can last, but intimate relationships will fail, and he can't save them. You gravitate to what your physiology knows to be familiar and conditioned to, even though when you know consciously and physiologically it's not good for you, you will still go towards it and have a bad outcome. So basically, these are questions you can ask yourselves. What were you wanted or not? Were you an accident or not? Did your mother want to abort you or not? These are in utero questions that are very important ones. Did your mother drink or smoke during the pregnancy? What was her cravings? Was she stressed or not stressed? How did she feel about it? And were you adopted? There's many questions. I mean, these are just a little snapshot. So basically, when the limbic brain pulls one way and the neocortex pulls the other way, nothing happens. You get stuck. You're stuck with your depression, you're stuck with the emotions, you're stuck with the anxiety. What you need to do is integrate the triune brain, bring it all together, make it one. And once you do that, then you can start hugging yourself and be content and be resolved, like these two bears. So I think that's the end of my presentation. So thank you very much, everybody. Any questions, please? Okay, so if there's no questions, does anyone want me to resolve something and treat something? I'm happy to do it. To give you an example of how this technique works. Anybody? Any takers? Come up. 8 sessions like that in clinic, and you get the results of people that are clinically depressed and clinically suffering anxiety, recalibrate themselves and recondition their brain, and they get out of that state. And think about it. This young lady had pain there. It was 10 out of 10, severe, and she's had that since the age of 5 and 6 years old. No, sorry, not since the age, 5, 6 years ago, sorry. And it came back to an experience she had with ex-lover that actually went out with somebody else. I mean, we've all had that happen, but you know what I mean? So we bury things in our own special way. And at that time, she buried it. But what brought it to the surface was her father having a heart attack and that shock of another male that she loved, that she didn't expect. So these are the conditioned responses that occur in us every day. And we can suffer anxiety and depression, and we don't even know it until you look for it. And simple techniques like this, then you can have techniques like yoga, qigong to help facilitate. So I would say definitely qigong and yoga will actually help facilitate that, especially liver, gallbladder positions will actually help that not come back. Then you could add to your repertoire and add things to actually assist you with. So anyway, that's one treatment. That's basically what it is. It's nothing mystical, it's nothing amazing, but it is in its own right. It's simple and it's magical. And you know, the irony is its application, as you saw, is not difficult, but the results are quite profound. And I'll finish on this. I just finished my PhD, and the p-values that I got on changing serotonin levels and dopamine levels in urine are something similar to what you've already seen. And the results we've achieved in, have we heard about interleukin 1, interleukin 6, C-reactive protein? All these markers are for heart conditions, cancers and things like that. And I've shown in blood work, pre and post, that within 1 month you can get people that are out of range into range just by this therapy. So that should get published soon. Thank you very much. Thank you. Oh, okay. Yes, I do. We're at, are you in Sydney? Yes, that's right. Okay, great. So we're in Macquarie Street, in Park House. So Park House, Macquarie Street.
If I search your name,
Yep, you can find me. Yep, okay. We'll be there. Thank you. Yes, sir. To actually apply NET and get trained officially with it, you need to have a minimum of a master's degree in a medical field, be a master's in psychology, medicine, chiropractic, acupuncture. There's some naturopaths that have a master's degree as well in certain research. So that's the benchmark. So yeah. Say that again? Yeah, you can buy one of those. Click away. Okay.
Can you let us have the website again? My body.
Netmindbody.com. Netmindbody.com. And if you want to, there might be some people in Hong Kong, I'll have to check, that actually do NET. But on that website, you'll see people that are registered in different countries around the world. And then you can find someone near you, hopefully. Yeah.
I just realized that the courses will be held tomorrow and Saturday.
Yep.
Are there any other courses scheduled along the line? We might not be able to make it tomorrow.
Ada? Possibly no, not at this point. But stay in touch with the Ho family, and I'll let you know.
And could I have a second question? It's about drug abuse. How does it fit into this? I saw you have a PowerPoint slide talking about alcoholism, people resolving to alcohol. Is it more or less the same for substance abuse?
It's the same thing. And there's a reward cascade that happens in the brain when you either do alcohol, drugs, sex addiction, gambling. It's a reward cascade that occurs. You just have to recalibrate, recondition the reward cascade. And if you can do that successfully, you will occur. See, unless you get to the exact issue, you'll get lost. So, for example, Rose, how would she know that that experience goes back to that experience at 20? And she might take, and don't get me wrong, it's just I'm just giving you an observation. She might take a year or 6 months, or with doing certain therapies. The thing I liked about this technique, and why I've followed it through for 20 years, is it's laser-like. It goes straight to the point. It's not what I think. I don't know Rose. She doesn't know me. We've just met each other. It's not what I think, it's not what she thinks, it's what her body responds to. And then we as a team have to work out why it's there. So we're using, so basically you've got the software and you've got the hardware. We're using the hardware to give us the information to the software. And then it's a true mind-body, body-mind connection. And that's how we get to, like a laser, to the issues that are in question.
I see, but there are so many things happening every day in our lives, and how do you sort out which are the stimuli that affects it?
And there's
how you iron this out?
In there lies the answer. We don't work it out. The body does. The body will tell you.
Really?
Yeah, like it did with us. We can sit there, oh, no, it's this, no, it's that. You're going to drive yourself nuts. Let the body do the work.
So the body won't lie, so it's not the self-interpretation or based on self-report, it's the truth. Could we say that?
It's a physiological reality. So that's what matters. Like I said, where's north? It's not what you think I think it is. It's your body response, because you're the one with the pain. It doesn't matter what the doctor thinks, but the doctor has to address the pain, then deal with it, and make your body okay with your own pain from your perspective. Not what I want to think as a doctor. It's got to be this. Because my ego can take over, and I can get confused and think, oh, no, so this, no, so that. And then 5 sessions down the track, after using 3 different drugs, you might come in and say, oh, you know what? You know, that neighbour moved outside. He's left, and my headaches are gone. There's your neighbour across the road driving you nuts. It's not that you needed to be on antidepressants. Do you know what I'm saying? So that's just an example. Don't get me wrong. There's place for antidepressants as well. I don't think anything's a cure-all. I think there's a place for everything, and it's up to the doctor's ability, not the patient. It's the doctor's responsibility to find the source. It's our responsibility to be skilled enough and educated, not stop the education, to find the answer. That's where it really sits. Yep.
I would like to know if the NET technique is useful to helping to heal people with phobia. And if it works, can you briefly tell me how does it work?
Yeah. Well, the answer to both is yes and yes. And what I can do is, maybe if you can go to the department with Professor, I'll leave references with her. There's papers published. There's actually a student that I sponsored at Oxford University that did a thesis, and a master's thesis, on phobia on spiders. And the same principles of phobia and anxiety about spiders applies to all phobias. It's the same thing. It's the same template. So we can give you that data. Okay? So yes, it does help with phobias. Okay? So I can't hear.
What's the difference of NET to EFT or TAT, other tapping technique?
Sure. Have you done EFT before? How do you like it? I think it's a good technique. It's a very good technique. And the gentleman that started it, I know him well. And he knows the founder of NET well. As you know, EFT, you're touching a lot of points and you're hoping to get the right point. But that's touching. It's the same thing. It's not laser-like. And you hope you're going to get the issue. But you really don't know what the issue was underneath. You just hope that all the tapping, you got it. It's like, oh, did we get it? Just keep on going. So what I'm trying to say is, it's a good technique. And I give it to some patients because they want to do something. They want to do something at home to say, oh, I'm doing something, so it helps them. And I think it's a good tool. But if you want something a bit more specific and laser-like, possibly NET would be giving you that result. But EFT is a good technique. There's nothing... Any technique is good if the patient feels well. You know? And the best doctor is the one that gets you well. That's the best doctor in the world. Doesn't matter who it is. It's because he got you well. So if you can get yourself well, then you're the best for yourself. So I think do as many techniques. And EFT, if that's not enough, then go for another therapy and look for something else. Because sometimes that's enough for somebody, and that's it. Leave it there. Okay.
Oh, excuse me.
Someone else? Oh.
Yeah. What are you doing tomorrow? And the day after tomorrow at your workshop, please.
What am I doing? Well, I think it's... well, in the workshop, I think you all got it. The learning objectives are here. So we're basically going to teach people how to... We're going to teach people how to muscle test and understand TCM, basic principles of NET, and do a lot of demonstrations. So, as outlined in the learning objectives.
So after the workshop, that means I can do something like Rose on, some like you on Rose.
No. Sorry. Thank you very much. I'm done.
Okay, thank you for coming, and please. Okay, and please be reminded that we will have the annual symposium on the 14th of November. So stay tuned with us on our Facebook page and Civic web page. So we'd like to see you again. Thank you.